Welcome to Turmeric and Tequila with your host, Kristen Olson. Questioning a better way, one gracefully disruptive conversation at a time.
Welcome to Turmeric and Tequila. I'm so excited to be here today. We have a very special guest in the house. You know, I'm a health and wellness and fitness professional, but also nerd in that space. So we are going to nerd out today on all the details around regenerative health and stem cells. Before we jump in, I want to give a special thank you to our sponsors, Colorado Clownfish Swim School. They are swim lessons and water safety training for all ages. They believe in life skills through sports. So go check them out today. Tons of Black Friday stuff going on. Water safety and swimming is a life skill. So go get your family waterproof today. They are at coloradoclownfish.org. And Declan James Watches, they are local and veteran owned with 10% of their proceeds going back to the Navy SEAL Foundation. So go check out those local rock stars. Without further ado, I want to welcome the Dr. Choi Kong to the TNT mic. Welcome.
Thank you so much, Kristen. I'm so happy that I made it.
Yes, it's the week in transparency on the mic. It's the week before or the week of Thanksgiving. So there's many moving parts. Before we jump in, I do want to read your bio just because it's so impressive. Dr. Joy has been on ABC, NBC, all the TV shows, tons of stuff. And I'm actually surprised we have not crossed paths sooner just because I'm a CrossFitter and we do all things human optimization with my business. But here's her background because she covers so many bases. Dr. Joy Kong is a regenerative medicine physician and author whose journey began in China during the Cultural Revolution. After overcoming early adversity and an abusive relationship, she came into the United States where she became a UCLA-trained triple board certified anti-aging specialist. She was named Stem Cell Doctor of the Decade in 2021 for her pioneering work, and Dr. Joy is the president of the American Academy of Integrative Cell Therapy and author of the award-winning memoir Tiger of Beijing. And I didn't mention this, but fellow podcaster. So that's a lot. You've done a lot thus far.
It's a lot. It keeps me very busy.
I believe it. Well, before we get to the human or to the mission, I want to unpack the human behind the mission because I think who we are is written in the stars very early. So tell me about you as like a young person, and was there signs of what you're doing now way back then?
I think so. Looking back, I was just a very open kid and fascinated by life. Even the blood flowing through our body, just the miracle of what makes life and what does it all mean. So I was very curious. And my mom had a lot of back pain. So when I was little, starting maybe 12 years old, I started giving my mom massages and just kind of envisioning using my healing energy to help her feel better. And I was like, I feel this healer inside of me. I feel like I have this ability, I have some power within me. So that was kind of the early inkling, but I was very open to a lot of things. Medicine and life is always fascinating to me. But I actually went to a university in Beijing studying architecture. So I was, I could go into any directions, right? Life is fascinating, the human existence. So I could do a lot of different things, but I talked about it in my book, how I actually made it to America, and that took me away from architecture and into eventually is very, very roundabout ways, eventually back into science and biology and eventually medicine. So, but even when I was still in China, trying to leave the country, I was learning skills like acupressure, um, ways of healing the body by using energy, right? By activating certain meridians. And that was kind of my, it's always in my life, basically. And my mom was healed by Chinese medicine from a very, very scary form of cancer, multiple myeloma. So everybody thought she was going to die within a few years. And she was in a hospital and was treated with chemotherapy for 6 rounds and lost a lot of her hair. And most of the people who were on the same ward with her have died. So she decided to leave the hospital and go get a prescription from a Chinese medicine doctor, and she went home. All she did was drinking this concoction twice a day and then doing aerobics. And within 6 months, she was healed. She was completely well, went back to work, and lived for another 32 very productive years. So that's kind of my background, the passion for life and my personal experience witnessing the power of looking at the body as a whole, resorting to something like a holistic approach to the body. At the same time, I'm fascinated by science. I love physics, math and biology, and going down the nitty gritty chemistry. So I wanted to utilize that part as well. Eventually, I'm able to put the two together, believe it or not, through anti-aging medicine, especially stem cell therapy. So I feel like I'm come home in a way where I use both science and the tradition that I came from.
Oh, God, I love that so much. You really are perfect for turmeric and tequila because it's the juxtaposition of both things, Eastern, Western medicine blending, and then energy and science and, kind of the woo side of things. But you really need all those things, like you said, to address like the whole human approach and understand the facets of everything that's going on. And I'm curious on your thoughts on this, but, we go to school, we're intentional, whatnot. But when you look in retrospect, I say on the podcast, God, Universe, Madonna, I'm a huge Madonna fan. It's kind of setting you up regardless. Like you got to be intentional about your moves, but like your experience with your mom and just the life experience sounds like it prepared you in addition to like the schooling and all the intentional moves.
Yeah, yeah. So but not everybody who's gone through these will actually really pay attention, I think. But for people who are open, then it gives you this extra, like a philosophy that you can hold on to because you've seen something that makes a difference. So no matter how much brainwashing that we were given during medical school. I know plenty of medical students who go to medical school with an open mind, having been around different forms of medicine, not just the conventional medicine. And once they go through the medical education, they actually get locked into a particular mode. So
Yeah.
I think I just refused to be locked in. I just, I held on to what I witnessed.
Amen. That's so huge. I absolutely adore our practitioners in the medical field having that perspective because I've done, oh my gosh, everything from like Botox and all the beauty stuff to ACL recovery. I actually just got to the hospital from rhabdo, which is, I'm fine with a random thing.
Oh,
But all of this, you have to know that you've got to advocate for yourself because even a lot of the professionals in the medical situation, like you said, get so narrow minded, so locked into their path, they only know one side. So you might be recovering, but you're not talking about nutrition, or you might be doing nutrition, but you're not talking about exercise. So I've always talked about like our consumers or our patients, you have to stand up and ask questions and advocate because it's not often that you're lucky enough to get someone like Dr. Joy where she covers all of the human arena. I can at least give you advice on, let's change this or let's address this, but also what about this? Does that make sense? Do you see a lot of doctors kind of narrow minded?
I'm so embarrassed to say yes. And I
Yeah.
wish it's different. I wish the doctors are just a lot more open, but I see this everywhere, even in China. China has bought a lot into the entire conventional Western medical model. So in the hospitals, if you go to a hospital, I would say 90% of the hospital is practicing conventional medicine, but they do at least have one traditional Chinese medicine department, right? That's something we don't have in the US, but at least they have that. But I think in practice, the Chinese people use both very liberally. And
Yeah.
although there are Chinese people who only bought into conventional medicine, that they got brainwashed in a sense, but a lot of them, I would, if I had to throw a number, 80% of Chinese very much embrace traditional Chinese medicine and incorporate that into their daily lives. But in the US, of course, is less open than in China because people don't have the experience of all this success from this different approach. So the conventional medical model, we were groomed. I went to UCLA. So even though I'm in the West Coast, you would think we're a little bit more open. Yes, we do have elective course about East-West medicine. You're combining the two. but that's one course a student can choose to take or not to take. So the education is very much tailored toward drug prescription. So the entire education, yes, you need to understand the human physiology and how everything, all the organs work, but the bulk of it is to identify disease. So we wait until things are wrong, and now we can do tests and imaging, and everything is geared toward identifying a name of the disease, because the name of the disease is connected to the medication, the drug that's that someone is making money from. And so your education is really gearing toward eventually landing on a drug. Now you can use a drug to give to people. However, the usefulness is very questionable. There are useful drugs, there are good drugs out there, but the whole philosophy of how to treat a disease, how to treat a person, is very narrow-minded, is very one-sided toward looking at very, very small relationships. Maybe one, they think, oh, there's a receptor that's not activated. So if we just activate that receptor, all of a sudden, the muscle will be working, or this particular organ, this function is going to be unlocked. It's very, very childish in its way of looking at the body, because the body is so complex. It's not addressing why the person is getting a problem in the first place. Why did the receptor not work? So what's going on? Was there an issue with nutrition? Could there be a shortage of a mineral that's causing this problem? Could it be hormonal imbalances? Could it be toxicity that's locking up the cells? Could it be some kind of energy, that we know we're in the midst of, we're surrounded by energy, right? The solar energy, electromagnetic energy, all these things flow through the body. And if you just ignore that, and you're only finding out, you're targeting a tiny, tiny piece of the puzzle. So you're not seeing the whole piece. And that's a problem. I still see that every day. I see that with patients that I treat, people who have gone to conventional medicine doctors, and simple things that I have the tools to fix, and they are suffering. Like today, I was just contacted by somebody who had severe, well, now has become severe wound on the skin from something looking pretty benign. But his doctor, the wound care doctor, didn't have enough tools. But but they don't know anything about what I'm doing here with stem cells and exosomes and peptides. And it's very easy for them to want to shut it down.
Right.
Even to this day, people challenge me on social media, because
Okay.
now I'm talking a little bit more about peptides. Oh my goodness. It's something as
Yeah.
simple as
It's all the
BPC
rage.
157. Boy, I got challenged by this MD who was telling me, well, you say all these things, that's great. Show me one article that actually it shows evidence of this peptide, doing anything. And I said, just Google search. There are so many articles. I don't know. I can't be devoting my life to answering questions that you can easily find answers to. I'm bombarded. I can't be answering everybody's question. And then his response was, see, typical response. So instead of giving me the answer, then you're telling me to look it up myself. And I was like, you are a doctor, right? You are a
Totally.
doctor. You should be a searcher. You should be a learner. So learn. Because you've just put in, I told him, put in BPC 157, what is it, scholarly articles. And then you will have all these articles
Mhm.
popping up. So you want me to send you all the articles on social media? I'm sorry. But that's typical.
Yeah.
It's so
Yeah.
sad that is actually typical.
Yeah.
So I have
Well, there's
patients
nothing more dangerous than a doctor with time on their hands. It's on social media questioning other doctors. Like clearly
attacking
there's already a
others.
miss there. Yeah,
Right. By
I
the
mean,
time
they've
you
got
finish,
time. And
you
the
could
flip
have
side
found
is
out these, 50 articles that you could be learning from.
absolutely. But I mean, here's the thing, take the engagement. Just like I tell all my like intentional influencers out there, regardless of background, like just take it as there's always gonna be haters and people.
No kidding. Yeah. So
So you just gotta
even
lean
even
in.
I have patients who want to do stem cell therapy, and who are hiding it from their doctors because they felt that they were going to object to it. So they would rather just do it in
Okay.
secret and get better. What's fascinating is that after they get better, they go back to the doctor. The doctor says, how come all your markers, everything's improved? What's going on? And they said, well, I actually did
Yeah.
stem cells. And the doctors, the overwhelming scenario I hear is the doctor just doesn't say anything anymore. Basically said, oh, wow, no curiosity of why somebody
Wow.
else is giving something that's really, really interesting, right? You don't know anything about, but it's reversing a condition that you have not been able to help. My first response would be, oh my goodness, what have I been missing? I need to know about this. But so many of them are not. And the problem is that
Yeah.
they are hurting their patients. It's not just they being closed-minded. If they just affect
Yeah.
themselves, who cares, right? It's your life. If you don't want to learn, you want to be sick, okay, this is yours. But people have entrusted their health and their life. It's not just health. Health governs everything else. It's their life. There are people who want to give up on life completely because they can't get better. You, as a healer, you have the responsibility to show them the way and to give them everything there is that's possible. So unfortunately, people are so locked into how they were brainwashed, and they just they veer people away from possible healing.
Ugh, amen. Well, and I have gone, and it is so popular that this happens. I've seen, like I said, I work in health and wellness, longtime athlete, so I've seen so many doctors and so many opinions. And I'm pretty like I like a mix of things, and I have really good go-to humans at this point that I can double check stuff. Even like when I was in the hospital, I was texting my people. So you got to build your team as an individual, as a patient, as a consumer. So I love that our young people are out there seeing things, and like there's things like podcasts and TikTok and socials where they can start to see humans and doctors and professionals like you speak, and then they get to know and get to see things way earlier than like our generation did. I do want to unpack stem cells specifically because this is something that's been in my world, and I considered putting them in my knees, oh god, like 5 or 6 years ago. And I, like you, I got so many opinions, so many people told me not to do it, and then I had individuals that did it and it literally healed their ACLs. I had other athletes that went to Mexico and got it like in their back, and that works, so they'll go to like other countries. Tell me about like stem cells for your body, for your face, like where, give us what the 10,000 foot view of, just if you don't know about stem cells at all, like lay it out there.
Yeah, think of stem cells as the place where the messages come out of, because we all came from a single stem cell. So that stem cell basically embodies all the capabilities and miracle and wisdom, right? From is the information that's embodied by that one single cell, and that has the ability to form an entire complex human being. Just imagine from one cell to 37 trillion cells. Like, how did it do that? And how did it form something as miraculous as each one of us? So that's the is the information, it's the intelligence. It's basically intelligence. So when I give people stem cells, I'm injecting into the, I don't care if it's the veins or the face, I'm injecting intelligence. So from that intelligence, it's going to tell the body what to do. You can put the cells into the veins and that will travel throughout the body. The cells have the intelligence to know where to go because they're attracted by signals of distress. So then they can find their way to the place where they need help and then secrete just the right messages. Your knees may need a different set of messages than your pancreas, which may need a different set of messages than your brain. So the cells have the adaptability to give you the messages that you need to repair each location. So that's what's revolutionary, right? In human medicine, we've never been able to just inject intelligence, and the entity knows where to go. So that's the beauty of Western medicine, that we now have dissected things down to the cellular level. And we found these incredible cells. Now we can use these cells to promote repair. And the cells generate these different ways of communicate. One is the exosomes. Exosome, just a little nanoparticle that's got a lot of growth factors and signaling molecules, even tiny pieces of RNA, all within this little nano package. And that gets sent everywhere and can merge with your cells and change how your cells are functioning, or just change the environment. So they're depending on what you're doing, but there are also different cell types. So that's the
Right.
complexity of stem cell therapy. We just talk about stem cells as if it's one thing. There are probably thousands of different kinds of stem cells, all on different journey in the evolution, from the very beginning, which is the embryonic stem cell, all the way down to the liver stem cell, which will produce a liver cell. That's all it can do. But anywhere along the way, it has, so as it evolves as a stem cell, the more they differentiate, which means gaining more function and make more capabilities, the less that they can become anything. So the narrower the range of who they can become. So either you gain a lot of capabilities and lose some potential, or you have a lot of potential but you don't have any specialties. So that's kind of the way the evolution of the cells. So anywhere along the way we can intercept and grab the cell along that pathway, and that can affect everything that's below that capability, right? That's the range of capability that cell has. So we use mesenchymal stem cells, which is a very special type of cells, stem cells in your body, because it took on the role of the conductor of the symphony of regeneration. So literally is the ones that are sensing what's going on in your body and sending themselves out to different places and secrete the signals to signal your own immune system and signal your own local environment to make this repair happen, right? You take away bad cells, you take away things that don't belong, you break down scar tissue, and you rescue cells that don't have to die, and then you trigger the local stem cells to divide to make new tissue. So that's what mesenchymal stem cells are. And they have become the mainstay of stem cell therapy, even though there can be many other ways of doing stem cell therapy. But this has become like your friend, people who've gotten injections. Most likely they were getting treatments from using mesenchymal stem cells, but you can use other forms of cells as well. But what I do in the clinic is that I use mesenchymal stem cells from the umbilical cord, plus all these other cell types from umbilical cord blood. So the cord tissue has a lot of mesenchymal stem cells. The cord blood has some. The amniotic membrane has some mesenchymal stem cells. They're all mesenchymal stem cells, but all a little different because they came from different sources. They have different pathways and they secrete different growth factors. But in the meantime, I also want to utilize cells that are not mesenchymal stem cells because they all work together. So these are premature or primitive immune cells. They are endothelial progenitor cells, can form new blood vessels. They're fibroblasts, right? Form all the connective tissue, and they can form the whole bloodline. So in this, cord blood has all these cells together. So when you combine them, then you are capturing the full potential of regeneration that this very young source has. So the younger source it is, the more potent the cells are. They have more abilities to differentiate into different types of cells. They have more growth factors that they secrete, and they have longer generations left. Their telomeres longer, and and they actually are smarter. They're smarter. Just one thing that we know they're smarter about, at least, is the ability to detect cancer and to get rid of cancer. So when you use cells from your own body, unfortunately, these cells have gradually lost its capabilities and intelligence. And instead of telling cancer cells to die, it's telling all the cells, including cancer cells, to grow. And that's the risk of using your own cells. That's why I'm not a proponent of it, because there's research studying exactly comparing the different sources. And you can see how younger sources will protect your body against cancer.
Well, I just want to jump in. I know that you said that's amazing. Thank you for that explanation. It's really hard if, again, I'm a human in this industry, and it's pretty hard to find a really good breakdown that's not biased, selling one thing or the other, like within stem cells. So thank you for that breakdown. And you answered my question. One was like, do you use others or do you use the persons? Because then my second question was, well, now that I'm 45, whatever, people will say like, you're too old to do this, or you need to do it for your 50. But then I had heard about umbilical cord cells. So using we'll say other people's cells. What is the conversation around like sourcing those? Like, do people get weird and political, or is it like, obviously you're upfront on how you do this. I'm all for using cells of someone else, particularly, at 0 years old, quite literally, versus my 45-year-old cells. Tell us a little bit about the process of sourcing them, and if there's any like transparency conversation you have around that.
Yeah, so there are a lot of misunderstandings, and some people think that the umbilical cord stem cells is somehow related to aborted fetuses, which is absolutely false. Because in this country, using fetal stem cells is illegal, and I don't know anybody that does that. So what
Right.
we use are from live healthy births. And you mentioned 0 day old. The baby has 0 day old stem cells, but the umbilical cord actually is the minus how many days, because when the baby was forming, before the baby was
Okay.
born, right, when the embryo was forming, a lot of the cells were trapped in the umbilical cord. So as the baby grow, the cells still were in the cord and has retained a lot of characteristics of the embryonic stem cells. So the baby no longer have that kind of potent expressions, but within the umbilical cord, these cells still have them. So they're in between the embryonic stem cell, which is the first, within the first few days of the embryo's formation, and the baby stem cell. So um, for one, we use this potent source without harming anybody, right? The baby, we actually we select the healthiest baby. We don't, if the baby, the mother, the family have any problems, those are going to be screened out. We're not going to accept. I can't speak for every laboratory and every operation, but I did start a stem cell company, and our criteria is absolute 100% certainty, 100% basically, as far as the screening goes, that there's nothing that was concerning. So the mothers were screened for not only their own health history, but their family history, social history, right? Do they smoke and drink, and their travel history, their work history, toxic exposures, and sexual history, prenatal history. So everything is screened for. And we only accept these the mother and baby who are super healthy, and they have to be willing to go through cesarean section, because we are not taking any tissue from a vaginal birth, because if anyone has seen the birth process, is not a sterile process, is everything
Right.
all coming together, everything's everywhere, so
Yeah.
you cannot be sure that it's not going to be contaminated. But if you get the tissue from cesarean section, it's a surgical field, so we only take donations from scheduled cesarean section, right? No emergency cesarean section. Actually, if it's
Yeah.
anything that's emergency, we won't take the tissue. So it has to be peaceful, all planned, and in perfect health, and that's what we take. And once we get the tissue, we test for the mother's blood and the baby's blood, because there are certain pathogen screening that you have to go through to fulfill the criteria set out by American Association of Tissue Banks. Just one thing people need to realize: we're not giving drugs to people, right? We're giving cells. These are considered tissue. So this is a tissue transplant. So it's governed by this entity called American Association of Tissue Banks. So it's not really governed by the FDA. FDA may want to exert some kind of oversight, but the standards is set up by American Association of Tissue Banks, and they require certain screening. So if you are getting any kind of organ transplant, it needs to fulfill these criteria. So it's the same thing, no different for stem cell infusions. So these stem cells, these tissues, umbilical cord, placenta, these tissue need to be examined and screened for the same way. So they have to, is as strict, if not stricter, actually, we screen for more pathogens than what's required. And then after the tissue is processed, after the cells are separated from all the connective tissue, right? So we got floating cells, and then they are carefully cryopreserved. So they are literally frozen in animation until you're ready to use them. So that frozen material is sent to a third-party testing lab to test for sterility, to see if anything was introduced during the processing. So if there's any contamination, then bacteria is going to grow, and then that batch is going to be rejected. So that cannot be used for human consumption. So that's kind of the process.
It's absolutely incredible. I don't know that all people know how big of a deal this is, because now we can potentially navigate around massive surgeries or major changes of life, which, like you said, it's not just the physical, that's your mental health, that's your lifestyle, it's your whole human approach to your life. I want to know specifically, like, what kind of situations are stem cells ideal for, and what kind of people? Like me, as a 45-year-old female that's still active, and I'm looking at like a knee replacement, ACL 2001, like I'm bone on bone at this point, no cartilage. Like, what does it look like for specific type
Yeah.
of injuries?
First of all, don't believe when anyone says you're bone on bone. That's it. That's the end. No,
Well,
when
we're
it's
not giving
bone
up.
on
Don't worry.
bone, yeah, bone on bone. There may be one area that's bone on bone. You still have a lot of cartilage. There's a lot of
Okay.
cartilage in the joint, so the cartilage can grow, right? So if you have an area of wear and tear that your body wasn't able to mount kind of rejuvenation or regeneration, now with the right signals, all your cartilage have cartilage stem cells. So those are the end stage stem cells, because their only mission and capability is to become a cartilage, right? So in every organ, you will have that an end stage stem cell. So within those, within the cartilage tissue are these cartilage stem cells. So the
Mhm.
right stem cells, I was talking about mesenchymal stem cells being the signaling, the conductor of the symphony, sending in just the right signals to wake up those cartilage stem cells, and now they can grow, and then they can grow in, because I've seen that. I have my patient who had cartilage regrowth. You can regrow your cartilage. So
Wow.
don't give up. Is it
Okay.
possible that it's not going to get you to a point where you don't need knee replacement?
Yeah.
Yes, anything is possible, but you owe it to yourself, because so many people. I'll just give you one study. So they had 30 patients that had basically bone degeneration and joint degeneration, that they thought for sure that these people need bilateral knee replacement. So these were caused by steroid overuse. And what they did was that half of the, one knee in each person is going through knee replacement. The other knee is treated by stem cells. So 30 knees got replaced and 30 knee got injected with stem cells. After 6 years, out of the 30 knees that got replaced, 6 needed revision surgery, right? It means things didn't go right and they have to go back and reoperate. Out of the 30 knees that were injected with stem cells, only 1 actually needed knee replacement after
Wow.
6 years. So
Wow.
that gives you an
Okay.
idea. So if you
Yeah.
have a chance to save your knee and
Yeah.
not go through
Absolutely.
that, why wouldn't you? Right. And
Mhm.
then we come to your age. I love that you're 45, because that's when I started doing IV stem cells on myself. And that's when I
Okay.
was 45. Now I'm 54. So
Okay.
I actually look younger than when I was 45.
You look amazing. Let's go.
People
And
tell me that,
you're gonna
it's
feel amazing too.
embarrassing. Thank you. Thank
Yeah.
you. It's embarrassing because when I was 45, I thought I looked fine. And then, but then now I do side by side comparison. I was like, oh, that's a little embarrassing. I didn't know I was
Okay.
aging, but obviously I was aging. So if you don't do anything, then life is going to take its course, right? But if you give your body the regenerative juice that has been getting less and less, all of a sudden, then your body can wake up and get back to the younger state. So I've been doing IV stem cells on myself every 3 months for the last 9 years.
Okay.
And
Just like in
it's
general, or knees, or where?
IV, yeah,
Oh,
because
IV. Gotcha.
when you
Okay.
do
Okay.
cells, from an IV route, you're elevating the life force of your entire body, and that goes
Oh,
to everywhere, right? I've rarely,
okay.
I might have injected into one of my knee once. I think maybe it was bothering me. It was years ago,
Okay.
and I rarely needed to do local injections. I've
Gotcha.
done a couple times injecting the face, for facial rejuvenation,
Yeah.
and I might have injected. No, I haven't. So we do all kinds of injections, but I don't
Yeah.
think I've done that. But we inject
Okay.
into the penis vagina, right, to
Okay.
rejuvenate. And I don't think I've done that. And then and what else do we inject? Oh, we can do intranasal. That's we usually either inject stem cells into the nasal membrane, or you can use exosomes, which doesn't require injection, which is a lot more pleasant. And that will allow all these regenerative elements to go straight across the blood-brain barrier into your brain, to rejuvenate your central nervous system. So there are
Wow.
different ways you can do it. 20% of patients who come to my clinic are people who don't have any illnesses. They're just doing pretty well, and they
Yeah.
want to continue to do well. And the other 80% have serious issues, because these are the people who just, their conventional medicine doctors were not able to do enough to help them. And I've helped so many. And it's so satisfying, because I was trained, I went to residency 4 years to be trained as a psychiatrist. But I obviously had a career change. Now I'm going back to the healer that I am, which is for the whole body, right? I want to help people with mental health, but I realize that you are not addressing the body, because the body actually has a lot to contribute to how your brain works. So now I
Yeah.
can become a full doctor, that I'm addressing the entire body. And at the same time, I feel like I'm more effective than a psychiatrist at helping somebody with mental health issues, because I'm helping the whole body. I can address things that the psychiatrists have nothing, they can't do much about. So a typical example is myself.
Mhm.
I didn't have the tools that I have after I got into more of the holistic side of medicine or stem cells. I was very stressed during medical school. Of course, a lot of pressure and stress. So I ended up taking antidepressants, and I just kept on taking, I worked a lot. So I
Mhm.
got more and more stressed. I would, do fine. And then I'm being more stressed. I take more and take. So I was on a maximum dose of Prozac, and there's no more to where to go, right? I was a psychiatrist. I knew the next step is to take another medication. I didn't want to do that. And then I got into holistic treatments. I've been off these medications for, I don't know, 4 years at least.
Nice.
So it just got less and less and less, until I guess there's no need, because I'm addressing what the root causes are. All the inflammation, the neural inflammation that's perpetuating this feeling of being depressed. But if I can help the body to reduce that inflammation, now there's an information highway, right? There's a pathway. Everything is talking to each other. My cells are functioning at a higher level. So that's what I'm trying to bring to people. But yeah, talking about what it can help in my clinic, literally people fly in from everywhere in the world, and with all kinds of difficult conditions. Some of them there's no literature about. A lot
Right.
of the conditions, there are actually published articles about stem cell therapy helping these conditions. So that's great. But so many illnesses are either too obscure, or somebody just haven't devoted the energy and the money to study it. So we have to look at what caused the issues. And if the cause has inflammation as part of the genesis, or have immune dysregulation, um, then the stem cells come right in, because those are the two foundations of what it can do. So autoimmune conditions, a lot of the modern diseases is immune dysregulation, cancer. And then if there's tissue damage, there's any injury, the cells come right in. If there's fibrosis, the cells are anti-fibrotic. How many things in medicine that can break down scar tissue? Just about almost none. Maybe some energy medicine that we can do, but
Yeah.
no drugs. So and if yeah, and there are also people who are suffering from infections. So even the stem cells have antimicrobial properties. They can actually secrete antimicrobial peptides. So there's like a whole slew of capabilities of these cells. So sometimes it doesn't matter what they have. If the underlying causes would touch upon any one of these, I know I can help. So that covers just about
Yeah.
95% of the
Everything.
chronic illness in the world.
Yeah. I mean, how do you scale yourself? Like, I mean, are you getting overwhelmed and inundated with people, like, as you're on the mic and you're exposing the gospel of this? Like, are people really, like, on the bandwagon?
It is a lot. So
Yeah.
I have several doctors who work at our clinic, who that we have, it's like a joint force, right? They all have their own expertise, but if I add on this stem cell portion, then we elevate our capabilities. So,
Yeah.
um, but I also train a lot of doctors. So I have set up an academy, American Academy of Integrative Cell Therapy. Actually, in January is our fourth certification training course, and that has being very popular, and I see a lot of need that more and more doctors are waking up to this possibility, and they want to incorporate this into their practice, but they don't know how to do it. So that's where I come in. I teach them on all the tricks in the books.
Yeah.
Well, there's really no books almost. So this is all kind of in the field that we've come together, uh, for me and from different practitioners, their experiences using the cells that I'm providing, and understanding what different approaches are and what may be the best protocol for different issues. And now we're forming this basically a new branch of science, a new branch of medicine. Yeah, so I multiply myself by
Teaching
teaching.
more. Yeah, absolutely. I love it. I mean, I'll have to do some more digging. I got on the business and marketing inside, just like as far as like actually spreading the gospel, not from a marketing standpoint, but genuinely sharing this option and this situation and intel with people like myself. Like before you cut your knee in half, like let's talk about this. Really just advocating for the consumer. And I hope more doctors lean in and add this tool to their tool belt, like you said, so they can better serve the community. As a potential patient or consumer, what's like if someone's questioning this, tell us like what's the best step one and what should people budget like monetarily, time wise, like how many appointments? Give us some of like the quick intel if like you're considering this.
Yeah, so at our clinic, I mean, as far as the process is that we treat each person as an individual, and each person will have a thorough evaluation with one of our doctors. That would determine how we're going to approach it. Do we want to utilize IV route? Do we want to just do a joint injection? Do we want, to inject into any other local tissue? So a consultation is important. And um, as far as the cost, a simple joint injection at our clinic is $5,500.
Mhm.
And for a IV infusion, it starts at $8,500. And the more product you use, the more expensive it gets. The um, how much cells you need is based on your body weight, your age, and your health issues. So that it kind of determines what the cost is. But usually upward, probably all the way to about $18,000. And if you add exosomes, that's going to add a little bit more cost. And of course, if you do different joint injections, a lot of people do different things together, so the costs add up. So what I know is that what we charge at our clinics is very, very reasonable, because
Yeah.
I know the kind of pricing people are charged, even overseas. People go overseas spending $35,000, $50,000, and it's not uncommon. So I try to make this really accessible. We even do income based discounts. We give significant discounts for people who can't afford it. So
Wow.
yeah, that's kind of the general process.
That's amazing. Yeah, someone that shopped this, and the reason I didn't do it is because I couldn't find a doctor that would advocate and say, yes, do this, and the cost, like the quotes that I was getting. And I even knew a doctor that I trained with that was going to give me a very, very, very deep discount. And it was still right along what you're charging. So, as someone on the other side, I can stand from unbiased and say that is actually very, very reasonable. I'm curious on the IVs. How many of those, like, I'm guessing it's, different for each person, but how many could you do a year? Like, do you have people sign up for just one and you're good? Or is it like you do multiples?
Well, I do it 4 times a year because the
Okay.
rationale is the cells live in your body for about 1 to 3 months, and the signals that they secrete will produce results for another 3 months. So basically, if you always want some cells around who are that's generating signals, then you probably want to do it every 3 months.
Okay.
But every 6 months, that's reasonable as well. And even once a year is better than not doing it at all. But I do have patients who wants to do it every month. So
Oh,
that's also
okay.
there are
Let's
people who
go.
are really, who are more active, maybe wear and tear on their body a little bit more, and they want to just be more proactive. And that's not excessive. So
Okay.
I just, I just do it every 3 months. I think that's very reasonable. But once in a while, if I feel like I need extra help, or if there's a very stressful situation for my body, I may do an extra one, as the extra boost. But yeah, I don't do those very often.
Oh, that's amazing. Who's the guy on YouTube? We won't digress here, but he's anti-aging. He's a guy. I can't think of what his name is, and he's like trying to keep up with his 18-year-old son.
Yeah, Brian
I
Johnson. Yes.
Yes, yes. Has he reached out to you? Like, has that happened?
And no, but
Okay.
he has other resources that he's
Okay.
working with. So I actually made a video commenting on what he was doing because someone asked
Okay.
me, because people were asking me, do you know that Brian Johnson did this treatment in the Bahamas? Can you comment on what he's doing? So I finally watched the video and then I did a response video. It's kind of fun because I just talked about what he's doing, which some of them don't make that much sense.
Right.
But yeah, I think there's a lot of stuff going on out there, and a lot of people are going overseas because they can get expanded stem cells. So that's when they grow them in a culture to huge numbers, and then they take a little proportion of this large number and give it to patients. So with one, let's
Okay.
say one umbilical cord can produce this many cells and can allow treatments for this many patients, maybe not that many, but when they grow the cells to 1,000 times as much, now they can treat 1,000, maybe even if they give people a lot more, right? They give people 100 times, usually 10 times, that they give 10 times the number of cells as what we do here. But all of a sudden the same batch can be given to 1,000 people, right? or at least 100 people.
Okay.
So
Gosh.
yeah, that's the difference. So, but the more you save a lot of money that way by giving people expanded cells.
Yeah.
Unfortunately, research have shown that they decrease in their potency, and even at 10 times the number, you have less benefits. So because they change when they
Okay.
divide, they don't just divide symmetrically. The nature of stem cells is that they divide asymmetrically. That's actually one of the definitions, because they have to retain their own population. So they preserve their population by dividing into a copy that's identical to itself and another copy that's more differentiated, that's got more function. So just by nature, that's the tendency. They would do this asymmetrical division, and then you will end up with a big batch of cells that are differentiated, that are no longer the original stem cells. That's one reason is it decreases in potency.
Oh my gosh. Okay. I mean, I have so many more questions. I have two more and then our closing question. But one, what's the recovery on this? Like if you get an IV or you get an injection, are you like good the next day? Or are there any residuals?
Oh yeah, you find the same day. You don't. It's
Okay.
anticlimactic, to be honest. It's like, oh,
Okay.
okay, yeah, I got stem cells. Yeah, usually there's no recovery time. Once in a while, if we inject into a joint, a person may notice some swelling and heat, and tightness, and that usually go away at most within 3 days.
Okay. And are people coming to see you or do you have other offices or representation anywhere else in the country?
Yeah, people are flying in to see us, and we have also delivered our treatment is through concierge service to other locations in the U.S.
That's what I'm talking about. Okay. Well, when you're ready to launch in Denver, call me. I have at least 100 to 200 people that will probably sign up tomorrow within my CrossFit crew.
That's
But
awesome.
yes, yeah, we'll definitely connect and chat on a few things. But my final and favorite question, especially for my successful intentional humans, what is success to you at this point?
Success to me is that there's a saying, right? If you bring forth what's within you will set you free. And if you don't bring forth what's within you will destroy you. So I feel that I've set myself free by bringing forth my potentials, because I've always known that I wanted to do something in this world. I wanted to be useful. I just knew I was useful, that I've got to do things. So no matter what, I squeezed myself out of China. It was not easy. I talked about how difficult it was in my book. I made myself to come this country because I knew that I could somehow blossom and manifest who I am. And because I did that, and that's the foundation of what I consider successful. And on top of that, in the process, if you can search and retain peace and joy, and that's really all that matters. So in that process, but you have to be who you are, right? Everything else can come through that. So I don't care what you think you want to be. You can, your goal in life could be just be a mother or be a good wife. That's fine. That's if that's what's within you and you bring that forth and that give you fulfillment, that's your life. And for me, I just have to respect what's within me. What within me is to do things in this world, is to make things happen. And then on top of that, I need to learn how to be at peace and be in joy. So that if I can, if I can have constant peace and joy, then I've really made it. I'm not quite there yet. I still get stressed, and there's still challenges. So I would like to, it's a journey. I'm a lot better at it than I was. So that's I would continue, to fight for that.
Ah, so well said. I love that you are equal parts harmony and equal parts warrior, and it's all through intentional healing. And I have not interviewed a doctor yet that's called themselves a healer. I've interviewed healers specifically that are certainly not doctors. So I really commit as a marketing branding professional. I have to give you kudos on your own branding. But it's really incredible. Like I said, I have so many more questions, but please go check out Dr. Joy on what she's doing. Check out her podcast. Her book is incredible. But this is really a human on the right side of what science and what our doctors should be doing. So go lean in and leave nice comments on her social media. Joy, where do we find you? Give us Instagram handles, websites, anything we need to know that's coming up.
Instagram, very easy, Dr._Joy_Kong. That's Kong. And my YouTube channel is a huge resource because I probably put out more videos about stem cell therapy, every facet about stem cell therapy than anybody I know. So take a deep dive and really learn, understand before you jump in, right? Get the treatment. And then our clinic is called Chara Health. So people can get on our clinic website and take a look at what we do. But I do have a personal website, which is joykongmd.com, that has everything on there, including the skin cream that I created that's 100% natural with stem cells and peptides in it. So if you're interested in super clean and potent cream that can help you regenerate your skin, and that's a place that you can find it. So that's the Academy website is on there, aaict.org, if you're interested in getting trained.
So many things. We scraped over the surface. So please go dig into all the intel that she has out there and all the offerings, because it's really a remarkable setup. And it really stems from that genuine heart space alongside the education and the ethos and all the trials and tribulations that she brings into it. So a really, really excellent find for TNT and for all of our audience. You will be a home run for a lot of the people that listen in. I do want to give a thank you to our sponsors, Colorado Clownfish Swim School, swim lessons and water safety training for all ages. They believe in life skills through sports. So go waterproof your family today. Again, go check out Joy. Check out everything we have going on for TNT. In the new year, we are launching coaching, or furthering it, I should say, and we'll be wherever you get your podcasts, and of course, all the things on YouTube. So take care of yourself and each other out there. Dr. Joy, thank you again for joining us.
Thank you, Kristen. You're fabulous. It's really,
thank you.
Really nice chatting with you.
Thank you for joining Turmeric and Tequila with your host, Kristen Olson. Tune in next time, and don't forget to subscribe on Apple, Google Podcasts, Spotify, or wherever you listen.